Hey, it's Chris Dewey again. So you have a Medicare Advantage plan and you'd like to switch back to original Medicare with a Medicare supplement to pay what Medicare doesn't. So here's the how, the when, and the why to make a change from an Advantage plan back to original Medicare with a supplement. Time out real quick though. For those of you that are on an Advantage plan, you know you have a qualified enrollment period when you can change right now. You understand it's between the Plan G and the Plan N supplement. You can go to mayrivermedicare.com. That's M-A-Y, River, Medicare, all one word, www.mayrivermedicare.com. And you can actually look at all the different Medicare supplement plans in your area, from lowest to highest premium. You can shop them out. We're very transparent. We're licensed to all different carriers. Click on a company that you like, and you can self-enroll. And what you can do is shop all plans. You're just going to put in your zip code, your date of birth, your gender, your tobacco status. Once you put that in, you click on continue. You're going to be able to shop out all the different Medicare supplement plans in your area. Once you see one that you like, you click see if I qualify. And then you'll answer a few health questions and finish the preliminary application. Now, this isn't an application we're going to send to the carrier. I'm going to personally call you. Once you're done with the health questions, you're going to find a day and a time for me to call you. I'm going to call you. We're going to go over your health questions together. The company you chose may not be the best fit because different insurance companies, just like different insurance companies charge different premiums for the exact same policy, different insurance companies have different underwriting standards. So one company might be real easy on diabetes, while another company may be very difficult with insulin or diabetic medications, with blood pressure medications. We have underwriting software that will pinpoint and find a company that looks at your health conditions most favorably. And that's the part of the finesse part of the job that I love. But this is just a preliminary application, but you're going to see all the Medicare supplement tools, most all of them. There's a few fly-by-night companies I took out of there that have only been in existence for less than a year, or companies that clients in the past have had real problems with paying claims, or perhaps they have awful customer service. But 90% of all the carriers that offer supplements in your county are going to pop up. Just simply pick one that you like, see if I qualify, finish up the health questions, submit it, and then pick a day and time for us to call you. We're the only company that I know of in the United States that offers this service. And I do this because of full transparency. I want you to understand we're licensed with all the different Medicare supplement companies. And just remember, these companies are standardized by Medicare, meaning the same. So whether it's Humana at $90 versus Blue Cross at $140, let's just use the Plan G. There's no difference in coverage or benefits. There's no one plan is not better than another. They all offer identical benefits. So moving forward, why make this change? There's two reasons, guys. First, you realize Medicare Advantage is not original Medicare. Original Medicare does not have a restrictive doctor network. In fact, with traditional Medicare and a supplement, you can see any of the 98% of doctors in this country that accept Medicare in all 50 states. And what's more, unlike with Medicare Advantage plans that require prior authorizations and denials for routine care for anything that costs money, these denials by the private insurance company for things like skilled care, outpatient surgery, expensive Part B drugs, original Medicare rarely will ever deny or require a prior authorization for that kind of stuff. For Medicare Advantage plan, you can bet your bottom dollar you need surgery, skilled care, expensive Part B drugs, or durable medical supplies. They're going to want a prior authorization from a doctor. Medicare, original Medicare, they side with the doctor. They pay their claims. They send the rest of the bill to the Medicare supplement company, which must pay all the rest. They must, by law, pay claims. They have to. So as far as costs go, let's use the popular Plan G Medicare supplement. That's what most people get. Your out-of-pocket cost with the Plan G Medicare supplement is the annual, one-time annual $257 Part B deductible. You go to the doctors a couple times, you hit that $257 deductible, you have no out-of-pocket costs for the rest of the year with original Medicare and the Plan G. So with Medicare Advantage plans in 2025, Medicare set the maximum out-of-pocket for Medicare Advantage plans at $9,350 per year. You go out of network, they set that at $14,000 per year. With these Advantage plans, you got to pay 20% of cancer treatments, 20% of Part B infusions and injectables, 20% of radiation chemo treatment, 20% of durable medical supplies. You're going to pay average hospital copay is $400 a day for days 1 through 7. You're going to get nickeled and dimed to death if they even allow you to get the care that you need. Also, you cannot just change from a Medicare Advantage plan back to original Medicare any old time you want. You've got from October 15th to December 7th to change from an Advantage plan back to original Medicare with a supplement. Now, you will want to pass underwriting first. There is underwriting for most folks. The process is you want to apply for the supplement. Once that policy is issued, then you want to enroll in a standalone Part D drug plan. D is in drugs. And that Part D drug plan will automatically kick out the Advantage plan. But we want to have the Medicare supplement in place before we enroll in a Part D drug plan that kicks out the Advantage plan. So there are other special situations throughout the year where you can leave your Advantage plan and move into original Medicare with a supplement. And actually, these special circumstances do not require underwriting. So let's say you have a Medicare supplement in Ohio. You move to South Carolina. Obviously, these are regional, local types of HMO, PPO plans. The plan, 99% of the time, the plan you have in one state is not going to be offered in a different state. If that's the case, which 99% of the time it is, you can get a Medicare supplement, Plan G, with no health questions or underwriting asked at the lowest monthly premium with any company of your choice, because it's called a guaranteed issue. Guaranteed issue rights are for people that either move from one state to another, Advantage plan is offered, they can get a supplement, no underwriting, or if, for instance, you lose your retiree coverage, you can get a Medicare supplement Plan G with no health questions asked, or in our area, 7,000 people lost their Advantage plans. If your Advantage plan terminates, it's not being renewed, you get a Plan G Medicare supplement with no health questions or underwriting required. You go to MayRiverMedicare.com, and on the home page, you're going to see shop plans and self-enroll. There's a great how-to video on how to use and shop plans and self-enroll right here. We talk about rate plans and options here, but let's cut to the chase. You have a Medicare Advantage plan, but considering a supplemental plan. You're going to click here, and it's going to ask you, all right? Once again, it's going to say, I have an Advantage plan, but I'm considering a supplement. You're going to click on it. There's a video there that we're going to have up momentarily, but let's just click continue. You got two choices. You're going to go with the very comprehensive Plan G, pays everything except the $257 annual deductible, or you get a Plan N, much better rates, much better rate increase history. The only difference is when you go to a doctor's office visit, they both have a $257 Part B deductible. It's an annual deductible. Once after the first few doctor's visits, you'll hit that. With the Plan N, you will have a $0 up to $20 doctor copay, $50 emergency room copay. And you can click on this video to learn more about the difference in Plan N versus Plan G. But let's just say we already know it. You're just going to do your zip code. Let's just say I was born in 1957. No tobacco. I'm a male. We get the quote. And momentarily, it's going to pull up all the plans in your zip code. And it's going to go from lowest to highest. So you could watch this if you want this short video, or just click continue. So we got Humana at $77 for a 60. I was born in 57. So for a 68-year-old male, $77 for the Plan N. 81 with MedMutual. We have that up there, but I would not use them. They're brand new. We got Allstate at 83. That's with some discounts. Without the discounts, 86. If you're not married and you don't have a Fitbit or an iPhone that has monitors your health, that would be. And we can look at Humana without the household discount. We can look at Ace Property at 88. We can go right through ARP 8848. That's if you're healthy and you have an ARP membership. Federal Life hasn't had a rate increase in 3 or 4 years, 91. Allstate, so you get the picture. You go through, you look at all the different supplements, and you pick one. If you pick, let's just say Allstate. All right, now you're almost done. You got to answer some health questions. And you'll go through, you'll tell us what your Part A and Part B dates is, and very self-explanatory. At the end of this application, it's a preliminary application. We're not going to hit submit to the carrier until you set up a day and time for me to talk to you so we can go over, make sure your application's in good standing, make sure that we both agree on the right carrier for you based on your health conditions. Easy peasy. Within 15 minutes, you got a Medicare supplement. You're not dealing with a high-pressure agent that's got an agenda that's trying to push you into an Advantage plan, or perhaps a captive agent that can only sell ARP or can only sell Blue Cross. I'm licensed with all these guys, all right? So it doesn't really matter to me. What's important to me is that we find a carrier with low rate increase history that pays their claims, that's at least A-rated, that we know they're financially stable. Give it a shot. Go to mayrivermedicare.com. Start shopping out plans yourself, all right? You guys have a great day.